Anatomy and Physiology, The Skin and Its Tissues, Things You Should Know, Questions and Answers, by Rumi Michael Lee. I would like to thank and congratulate you for listening to this book, Anatomy and Physiology, The Skin and Its Tissues, Things You Should Know, Questions and Answers. This book will help you understand, revise and have a good general knowledge and keywords of the human skin and its functions. Thanks again for listening to this book. I hope you enjoy it. Part 1. 1. What kind of tissue is the blood? The blood is a connective tissue. 2. Why are all human cells not the same? All human cells are not all the same because they have different roles to play. 3. What is transplantation? Transplantation is the transfer of organ from one body to another. 4. What is a tissue that binds the body? A connective tissue is a tissue that binds the body. 5. What is a graft? A graft is the transfer of a tissue from one organism to another. 6. What is a system? A system is a set of organs performing the same function. 7. What are the main layers of the skin? The main layers of the skin are the epidermis and the dermis. 8. What is sebum? Sebum is the oily secretion of the sebaceous glands. 9. Where do sebaceous glands open? Sebaceous glands open in the hair follicle. 10. What is the function of sebum? Sebum lubricates the hair and skin. It protects the skin against bactericidal agents and retains water in the skin. 11. The sebaceous glands are governed by? The sebaceous glands are governed by androgens. 12. What is melanoma? Melanoma is skin cancer, a cancer of the melanocytes. 13. What is the danger of severe burns to the body? The danger of severe burns to the body are loss of fluid, which can cause hypovolemic shock. 14. What is used to assess the extent of a burn? The rules of nines. 15. Name the 3 categories of burns. The 3 categories of burns are first, second and third degree burns. Part 2. 1. What is vitiligo? Vitiligo is a pigmentation disorder of the skin characterized by a white spot. 2. What is the most superficial layer of the dermis? The most superficial layer of the dermis is the papillary layer. 3. What does the color of the skin depend on? The color of the skin depends on hemoglobin, keratin and melanin. 4. What stimulates the production of melanin? The UV of the sun stimulates the production of melanin. 5. What produces melanin? Melanocytes produce melanin. 6. Name the dermal appendages. The dermal appendages include nails, hair follicles, hair, sweat glands, and sebaceous glands. 7. What composes the hair? The hair includes a root, a medulla, a stem, and a cuticle. 8. Which gland secretes a saline solution? The merocrine sweat glands. 9. What are the functions of the integumentary system? The functions of the integumentary system include thermoregulation, protection, excretion, secretion, sensations, etc. 10. What is dermatology? Dermatology is the branch of medicine that studies the skin and skin diseases. 11. What causes the appearance of wrinkles? The appearance of wrinkles is caused by the loss of elastic fibers, collagen and subcutaneous fat. 12. What is the most common cause of skin cancer? The most common cause of skin cancer is excessive exposure to the sun, the UV rays of the sun. 13. Where are the skin receptors? The skin receptors are in the dermis. Part 3. 1. Is the epidermis vascularized? No, the epidermis is not vascularized. 2. What are the majority of epidermal cells? Keratinocytes are the majority of epidermal cells. 3. Where is the mitosis of new cells responsible for epidermal growth? In the basal layer. 4. Is there a clear layer in fine skin? No, there is no clear layer in fine skin. 5. What are the layers of the epidermis, from the most superficial to the deepest? The stratum corneum, lucidum, granulosum, spinosum, and basale. 6. How do epithelial tissues receive oxygen and nutrients? Epithelial tissues receive oxygen and nutrients from the connective tissues below. 7. What are the 3 types of connective tissues? The 3 types of connective tissues are loose, dense, and specialized connective tissues. 8. What are the properties of the 3 types of connective tissues? Loose connective tissues are rich in cells, dense connective tissues are rich in fibers, and specialized connective tissues contain a particular fundamental substance which is blood. 9. What does blast mean in fibroblasts? Blasts means to divide quickly. 10. Why is the cartilage slow to heal? The cartilage is slow to heal because it does not have blood vessels. 11. Does blood contain fibers? No, blood does not contain fibers. 12. Why is blood unique among the connective tissues? Blood is unique among the connective tissues because it is a fluid and does not contain fibers. 13. Epithelial tissues are aligned in what direction? Epithelial tissues are aligned in a certain order of polarity. 14. What is the unique capacity of a transitional epithelial tissue? Its ability to stretch. 15. Do epithelial cells form glands? Yes, epithelial cells form glands. Part 4. 1. What tissue supports the organs? Connective tissue supports the organs. 2. What tissue produces hormones? Epithelium tissue produces hormones. 3. What kind of tissue forms tendons? Dense connective tissue forms tendons. 4. How is the repair done when the tissue damage is very serious? The repair is done by fibrosis. 5. How is the repair of nerve tissue done? The repair of nerve tissue is done by fibrosis. 6. What is gastrulation? Gastrulation is the second phase of embryonic development. 7. What is fibrosis? Fibrosis is the excessive formation of connective tissue for repair to a lesion. 8. What tissue plays a storage role? Adipose tissue. 9. What is the difference between fibrosis and regeneration? Fibrosis replaces tissues damaged by scar tissue, but regeneration replaces tissues damaged by the same type of tissue. 10. Do connective tissues undergo mitosis? Yes, some connective tissues undergo mitosis. 11. What is glabrous skin? Glabrous skin is the part of the skin devoid of hair, for example, the palms of the hands, and the soles of the feet. 12. What is the main protective structure of the skin? The epidermis is the main protective structure of the skin. 13. Which part of the skin is the receiver of the sense of touch? The dermis is the receiver of the sense of touch. 14. Which part of the skin makes the hair? The hair follicle makes the hair. 15. What part of the skin is responsible for the secretion of sweat? The sweat glands are responsible for the secretion of sweat. Part 5. 1. What is the function of the nail unit? The nail unit protects the nails. 2. What part of the skin synthesizes vitamin D? The epidermis synthesizes vitamin D. 3. What are skin diseases called? Skin diseases are called dermatoses. 4. What are pores? Pores are the orifices where sweat is excreted. 5. What is excretion? Excretion is the evacuation or disposal of substances. 6. What are dendrites? Dendrites are cytoplasmic extensions. 7. What is symbiosis? Symbiosis is a profitable and sustainable association. 8. What is tegument? Tegument means coverage. 9. What is the function of the hypodermis? The hypodermis stores fat. 10. How long do we completely renew our epidermis? It depends from 25 to 45 days. 11. What produces freckles? The local accumulation of melanin produces freckles. 12. What is cyanosis? Cyanosis is the lack of oxygen in hemoglobin. 13. What is the pH of sweat? The pH of sweat is between 4 and 6. 14. What is acne? Acne is the inflammation of sebaceous glands that cause the formation of pimples on the skin. Part 6. 1. What is seborrhea? Seborrhea is an excessive secretion of sebaceous glands. 2. How many hairs are contained on the scalp? Approximately 100,000. 3. How many hairs are contained on the beard? Approximately 30,000. 4. What are the two types of hair? The two types of hair are hair in a child or an adult woman and adult hair. 5. What are the factors that cause hair loss? The factors that cause hair loss include stress, disease, trauma, protein deficiency, hormones, hereditary factors, some drugs, chemotherapy, surgical procedures, and age. 6. How long is a burnt skin sterile? About 24 hours. 7. What are superficial burns? Superficial burns are first and second degree burns. 8. What are deep burns? Deep burns are third degree burns. 9. What are benign tumors? Benign tumors are tumors that do not extend to other parts of the body. 10. What are malignant tumors? Malignant tumors are tumors that extend to other parts of the body. 11. What helps to absorb shocks in the hypodermis? The adipose tissues help to absorb shocks in the hypodermis. 12. What is the difference between nail growth and hair growth? The difference between nail growth and hair growth is that nail growth is continuous, but hair growth is cyclical. Part 7. 1. What is the third layer of the skin? The third layer of the skin is the hypodermis. 2. What part of the skin is the most sensitive and painful? The dermis. 3. What are cytes? Cytes mean cells. 4. What is responsible for skin allergy? Histamine is responsible for skin allergy. 5. What is the main function of adipose tissue? Thermal insulation is the main function of adipose tissue. 6. What is the middle layer of the skin? The middle layer of the skin is the dermis. 7. What is the function of platelets? The formation of a fibrous clot on an injured site. 8. What are skin appendages, and give examples? Skin appendages are productions such as hair, nail, etc. 9. What is the function of desmosomes? Desmosomes are links between cells. 10. Give another name for blood platelets. Another name for blood platelets is thrombocytes. 11. What kind of tissue is the dermis? The dermis is a connective tissue. 12. What is the function of collagen? Collagen ensures good skin resistance. 13. What is the function of elastin? Elastin ensures suppleness and elasticity of the skin. Part 8. 1. What is the function of the papillary zone? The papillary zone is a pain receptor. 2. Is the hypodermis a loose or dense tissue? The hypodermis is a loose tissue. 3. Which is looser? The hypodermis or the dermis? The hypodermis. 4. Where do we find the encapsulated corpuscles of Meissner? The encapsulated corpuscles of Meissner are where there are thick skins devoid of hair. 5. How do the merocrine sweat glands expel their secretions? The merocrine sweat glands expel their secretions through exocytosis. 6. What is secreted by the merocrine sweat glands? Sweat is secreted by the merocrine sweat glands. 7. What are the functions of sweat? The functions of sweat are to cool the body and the excretion of metabolic waste. 8. What kind of glands is found in the ear canal? Ceremonious sweat glands. 9. What stimulates the activity of sebum? Androgenic hormones stimulate the activity of sebum. 10. What promotes excess sebum? Acne promotes excess sebum. 11. What is the function of macrophages? The function of macrophages is immune defense. Part 9. 1. What is the function of vitamin D? Vitamin D allows the absorption of calcium. 2. What are the 4 phases of wound healing? The 4 phases of wound healing are hemostasis, inflammation, proliferation, and maturation. 3. Does the maturation phase involve the dermis or epidermis? The maturation stage involves the dermis. 4. What are the clinical signs of inflammation? The clinical signs of inflammation are pain, swelling, itching, and heat. 5. What are phagocytes? Phagocytes are cells that eat. 6. Are the nerve endings free in the dermis? Yes, the nerve endings are free in the dermis. 7. Do we feel pain when the dermis is destroyed? No, we don't feel pain when the dermis is destroyed. 8. The pheromone is perceived by? The pheromone is perceived by the brain. 9. Name a substance that aids communication between a mother and her baby. The pheromone aids communication between a mother and her baby. 10. How are bad odors of sweat created? Bad odors of sweat are created by the degradation of pheromone by bacteria. 11. What is the function of deodorants? Deodorants prevent the degradation of pheromone by bacteria. Part 10. 1. Which organs help to quickly recover blood? The noble organs help to quickly recover blood. 2. What are the noble organs? The noble organs are the heart, the lungs, the liver, and the brain. 3. What is the function of the Merkel cells? The Merkel cells are cells that detect stimulus and transmit these signals to the sensory nerves. 4. The synovial is what kind of tissue? The synovial is a connective tissue. 5. What is the vascularized region of the skin? The dermis is the vascularized region of the skin. 6. What is the outer part of the hair strand? The outer part of the hair strand is the hair shaft. Conclusion. Thank you once again for listening to this book. I hope it has helped you in your journey to understanding the anatomy and physiology of the skin of the human body.